The first clinical sign we're going to talk about treating is vomiting. Boy, wouldn't it be great if our animals would just go to the toilet rather than vomit on carpeting and bedding and things like that. But initially, vomiting is a protective mechanism. If an animal has had an incidence of what we call dietary indiscretion, that's simply eating something that is not good, getting into the trash, or just eating something that doesn't agree with them, eating too much, uh, then vomiting is a good protective mechanism. Gets the body gets the thing out that may cause more problems, more harm than good eventually. But vomiting can be stimulated by a variety of things, and if an animal has an underlying disease or viral infection, something like that, we need to treat that. And in the meantime, vomiting will eventually result in dehydration. So we don't want to continue that. Aside from, it's a very unpleasant experience if you remember your last time vomiting. So we need to distinguish between vomiting and regurgitation. This is going to be the fun part of your job, questioning owners about how their animal vomited and what they vomited up. Or is it regurgitation, which is a little different than vomiting? So in vomiting, you need to be able to describe these two processes to owners. So vomiting, it's usually related to a gastrointestinal tract or a systemic disease. There is a lot of retching. There are abdominal contractions. It's so hard to do these voiceovers without being able to use my hands to show you things. So I'm acting like I'm describing something that's active. So retching, that thing that you hear that makes you aware, oh, I think my animal might be going to vomit. And then abdominal contractions, and you watch the animal and the abdomen goes in and out. And if you took a little piece of litmus paper, which is a paper that can turn a different color depending on whether a liquid is acidic or alkaline, the vomit is going to be acidic. And we do use litmus paper more often in large animals, sometimes looking at what the contents of the stomach or the rumen, is it acidic or uh, alkaline, and that will help us determine what might be going on. But okay, regurgitation is more related to the esophagus. And there is no retching, there's no abdominal contractions. What comes up is neutral or alkaline because it hasn't gotten into the stomach and hit that acid environment. It's just been in the esophagus. And we think about regurgitation in a condition in small animals, in dogs in particular, um, known as megaesophagus. So this is a condition where the muscle tone of the esophagus has become very lax for whatever reason, and if the food collects in there, it does not pass into the stomach. We may have some kind of a stricture of the esophagus that is keeping all but very liquidy food going into the stomach, and then the animal will just regurgitate that. It just comes right back up. The esophagus gets distended to a certain point, and it makes the animal regurgitate it. So vomiting is very active, regurgitation not so much. Regurgitation will look more like food that has just been chewed, and it may be very tubular when it comes out as well. Whereas vomiting, we get the stomach acid, we may get more fluids in there. It tends to be more fluidy. So these are the fun questions that you will get to ask owners when they tell you that their animal has vomited, so that you can determine if they truly have vomited or regurgitated. Okay, but we established that it's vomiting. And what causes vomiting? There are a couple of areas in the medulla of the brainstem that we're going to talk about. The emetic center, I'm going to abbreviate that as EC, and it's also called the nucleus Tractus solitarius, and NTS is how we abbreviate that. So you'll see that sometimes if you're reading literature about antiemetics, or drugs that we do use to induce vomiting. So you need to be familiar with that. So it can be stimulated by 5 different types. So direct stimulation of things that touch on it, and we'll talk about what that is. The vagus nerve, remember the vagus nerve, vagus baby, as Dr. Lombard likes to say, is part of this parasympathetic nervous system. The chemoreceptor trigger zone, which is a separate little area next to the emetic center, and inner ear nerves from movement, so that's how motion sickness comes about, and then higher brain centers. And these are things that an animal may be very stressed, and that might induce vomiting. So let's talk about the emetic center and what stimulates it. There is a great video that Zoetis has. I'm trying to move my little field down here. Zoetis is the company that has a drug called Cerenia. This is the most recent anti-emetic drug for dogs. We can also use it in cats. And Zoetis has a series of videos. And if you go to that, if you want to take a few minutes and go to this and view it, it will give you a wonderful animation of how vomiting works. And it has receptors, and you all have just finished, learning about receptors and how they work. And so it's a great animation about that. You'll need to view, it's a series of videos, so you're going to need to click on the right side. You'll scroll down to this page, through this page, and you'll see the videos. And each time they end, then just click on the right side where that little arrow is, and it will show you the rest of the videos. But it doesn't take that long to view them. It's not an hour-long extravaganza about vomiting, but it's a really good animation about how it all works. So hopefully you viewed the video, but I'm going to talk about it, and you can also read in your book about vomiting. But this graphic from your book is really great because it shows how we have the chemoreceptor trigger zone. The chemoreceptor trigger zone, CRTZ, is outside of the blood-brain barrier. That means that things coming next to it, it's right next to the to blood vessels, and blood vessels can affect it because there's no blood-brain barrier to it. It, though, can send signals through the blood-brain barrier to the vomiting center, the vomition center. And that vomition center can be affected by things that affect the chemoreceptor trigger zone, things such as opioids. Opioids tend to induce vomiting in animals. Emetic drugs that we're trying to target to make the animal throw up, and then toxins that are a result of disease processes. In renal disease in particular, and some liver disease, can send out things that hit on this chemoreceptor trigger zone. That chemoreceptor trigger zone then sends the signal to the vomiting center. The vomiting center is going to be the one that induces all those activities, the muscular contractions of the abdomen and the retching, and the stomach sending that food out. And then I talked about fear, anxiety, stress. This comes from the higher cortical centers of the brain that then can also stimulate that vomiting center. And then the inner ear from motion sickness and motion movement. And you can see the vomiting center. Here's our stimulation then to the stomach and small intestine to induce the animal to vomit. And any injury of the abdominal organs, I want to just remind you, or stomach distension, can also cause an inflammation of the GI tract. From anything from parasites, any kind of inflammation can also send signals to the chemoreceptor trigger zone to induce vomiting. All right, so we need to talk a little bit about the receptors because they vary from animal to animal. So, and then also different drugs act on different receptors. So that's why it's important to know about these. It's not that I want to torture you with more um, types of detailed information, but we're going to talk mainly about these types of receptors. So, serotonin, 5-HT3 receptors, dopamine or D2 receptors, histamine or H1, acetylcholine. We talk about muscarinic acetylcholine receptors. That's why it's called, has this M. Norepinephrine or alpha 2 receptors, and norokinin 1, otherwise known as substance P, is a type of these receptors, NK1 receptors. That if you viewed the Serenia videos, they talked about these receptors because their drug affects these. And then opioid just hits on the chemoreceptor trigger zone. So again, the chemoreceptor trigger zone is outside of the blood-brain barrier. That means that everything that comes through the blood can have access to it, and it will detect these toxic substances in the blood and cerebral spinal fluid. It does have some contact with that as well. And it can go through the blood-brain barrier to stimulate the emetic center or vomission center. You'll see EC and VC I'll use sometimes in these. So again, some of the disease processes that can affect that chemoreceptor trigger zone are toxins that are produced in renal failure, and ketones in the case of diabetes mellitus, bacterial or metabolic toxins. If you remember, I talked about endotoxins in the anti-inflammatory section. Some of those endotoxins can also induce vomiting. So, of course, cats have to be different from dogs, and they have different receptors. And so some of the drugs that we can use for dogs cannot be used in cats and vice versa, or I should say are more effective in one species or another. So alpha receptors are more prevalent in cats. If you want to think of alpha and the A in cats, maybe to help you remember that cats have more of these. And sympathetic stimulation of those alpha receptors by stress or drugs can cause vomiting in cats. Dogs have more D2, so that's helpful, right? D for dogs, D2, dopamine receptors, and they have more histamine receptors than cats. So we tend to think about these receptors when we are stimulating or stopping vomiting in dogs. And then the higher brain centers, we don't want to forget this. Sometimes animals are just stressed. And so we want to question owners about situations where an animal might be stressed and that might have induced vomiting. And we aren't, it seems a little, we've been talking about acetylcholine as being the thing that will stimulate the GI tract in general through the parasympathetic nervous system. But we think that some of the sympathetic neurotransmitters that are stimulated in stressful situations can also affect the chemoreceptor trigger zone and then the emetic center. So I know when I bring my little dog to the that he has vomited, he has had diarrhea afterward. I can also stress him out a lot because he knows that I do things that the veterinarian does as well. But anyway, so we used to go to agility training, and that also was a very stressful thing for him. So it's hard to know what, stresses animals out sometimes, but um, that's something to also question owners about when their animal is vomiting a lot.